Mood. I can tell you right now, Helen isn't. She is at home with a bad banging head. She texts me. She can't speak very well, sore throat, sniffles and everything. What is going on? There's a lot of people who are getting flu out there, and we're going to find out more right now. If you have got the flu and you've just tuned in, obviously it's me, Poonam Verma, with you till 5 p.m. With me now is Dr. Pavan Shrivastava from NMC Healthcare. How are you doing, sir? How are you feeling today?
Yeah, good afternoon. I'm very fine.
You haven't had a cold recently. Have you been
No,
good?
no, not.
Okay. So let's talk about, so many people are ill, sore throats, coughs, sniffles. Is it just the season, or is it more than last year? Because I feel like it's more. I don't know why.
Yeah, see, the thing is that we get common cold whole year, but the influenza flu virus is mostly comes in the winter. But because last 2-3 years, because of corona, people were taking more care, using mask and all those things. So those years, influenza was less. But now, this year, we are finding influenza virus getting people infected more than previous years.
Okay, so I'm not a doctor, obviously, but I had a little bit of an idea, and you tell me if this is wrong or right. Because people have been overprotected, sanitizing, they've been wearing masks for a year or so, has that reduced the immune system so it's easier to catch things now this year?
No, not really like this.
Yeah, I won't
It's
be a
not
doctor
this
then.
thing.
It's nothing to do with that.
Nothing to do with that.
So should we just be wearing masks then? Like right now, if there's a lot of flu around?
Yes. Mask will help for all respiratory illnesses. The mask is a good thing to protect.
But it's not like it's winter here. Like if you want winter, I go back home to the UK, that is cold winter. So is it just a slight change in the season, or is it actual cold weather? Because it isn't that cold here.
The influenza virus mostly comes during this time. We start preparing to give the vaccination from September onwards, because we expect the peak of this will come by October, November.
But is this also because we have a lot of people traveling at this time, and it's easier for it to spread?
Yes, this is also one of the reasons, but mostly that influenza virus is in the winter months it's coming.
Okay, so what exactly is influenza? Like, what is it? Break it down for us.
The thing is that the influenza is like other common cold also, but then there is a slight variation. Number one, the virus which is causing the influenza flu is this influenza virus. There are 3 types, A, B and C, but mostly we get A and B. Then second thing is that the symptoms in the patient who get influenza is much more than common cold. In common cold, you get some headache, body ache, some throat pain for 1 or 2 days, and it improves. But in influenza, the patient gets very high grade fever, going up to 39-40 degrees centigrade, severe body ache, severe myalgia, fatigue, nausea, and you feel tired, really tired. So then symptoms last also longer. So it's the severity of the illness is much more than common cold, number one. Number two, the common cold doesn't have much of complications. The influenza virus, when get infected, especially in elderly people those are pregnancy, people are when children, people having lung diseases, asthma or kidney diseases, they can have more complications in the form of pneumonia, acute exacerbation of bronchial asthma, or even respiratory failure. So there is always chances of complications. That's why we need to be more careful with influenza.
You know, you're talking about body aches, and I was, as soon as you're saying it, I'm thinking, I felt a body ache the other day. So suddenly I'm thinking, oh my God, maybe I have influenza or flu. Touch wood, I'm okay. We're around a lot of people. There's a lot of people here in the office who have been ill. What is the quickest way for it to spread? Because we're all touching the same computers, we're all, touching the same doors.
All these respiratory illnesses mostly travel by droplet. When somebody is coughing or is sneezing, is spreading the droplets and which are containing virus, which can directly go to the contact in person, or it can go through some surfaces like doorknobs, or where he is touched, or you have touched your mouth and nose, or through this thing coming in close contact with the infected person.
But then it's not like you can really avoid it. I mean, the people who are not getting it, is it just a stronger immune system? They're taking better prevention? What is it?
See, obviously, like in COVID also, some people got COVID, so many people
Yeah.
didn't get.
Me
So
and
you
her.
have a inherent immune system. And some people, obviously, they must have taken influenza vaccine, which must be protecting them.
Yeah, you say that, but Helen is away today and she's got flu, and a month ago she took the flu jab. So should she be protected or...
See, that is the most important thing. So many patients, they do come and tell this thing that I have taken influenza virus. So all these studies which has been done, they have specifically shown that the people, those who have taken influenza vaccine, will have a shorter duration of illness, will have less symptoms if they get if they get influenza.
Okay, so they might get it, but it won't last as
It's
long.
not 100% protection. You might get, but obviously the severity of the illness and the duration reduces.
This content is for informational purposes only and does not intend to substitute professional medical advice, diagnosis or treatment.
This is Afternoons on Dubai Eye 103.8.
The UAE's #1 talk radio station.
It's Poonam Verma with you, filling in for Helen. How many of you had the flu jab, and now you've got the flu? Well, that's exactly what is happening with Helen today, poor thing. But we are talking about the flu, how to prevent it. Is it on the rise, or is it just a seasonal thing? We do have Dr. Pavan Shrivastava with us from the NMC Healthcare, and he's going to be sharing more.
Healthy habits.
On Afternoons with Helen Farmer.
So, Dr. Pavan, now COVID is still lurking around. It hasn't died a slow death yet. How do you know if you may have COVID symptoms or flu? Because they're quite similar.
Yeah, I fully agree with this, that the symptoms of COVID and flu are almost same. It is very difficult to distinguish by just examination or by listening to the complaints of the patient. So the symptom wise, it is also in the same fever, cough. But in COVID, we don't get much of nasal stuffiness, running nose, another thing. In COVID, in the flu, it is more of upper respiratory complaints like the running nose, throat irritation, and all those things. But you can have these symptoms with corona also. So obviously, whenever we have these patients, we need to check for the COVID also and influenza also.
So most people, if they're coming in with a few symptoms that are similar, you're going to test them?
Yes.
And have you noticed a lot of people have it, or is majority flu and cold?
Majority is flu, but we have got some people, those who are COVID positive, and some have both.
Okay. Have you noticed if those who've had COVID in the past are more prone now to getting a more severe cold or flu? Has research come out with that yet?
Yes. The thing is that as long as if we talk about the research, nothing much studies has come that they are more prone or not. But what we have seen in clinical practice, it's not that those people, those who have COVID, will have more severe, going to get infected.
Well, it's because we hear that sometimes COVID's made the organs or whatever weaker for those people.
Not really like this, but the symptoms, the cough and all those things may persist longer in the people those had COVID before, because of infection before with the COVID, their lung structures and everything is slightly deranged. So they may take longer time to recover.
So let's talk about the flu jab. Everyone had an issue at the beginning with taking a vaccine for COVID because we didn't know what was in it. Flu jab's been around for a while. I'm very holistic. I'll do everything. So if I know I've got a cold, I'll go straight to ginger, garlic, all turmeric, all the Indian spices that I grew up with, or, something hot to kill the germs as soon as possible. On the odd occasion, I'll have a paracetamol. Other than that, I don't actually take anything really. So I use that holistic way. So when I was offered the flu jab back in the UK, I was like, no, I'm fine at the moment. But should we all be vaccinated? Is it worth doing?
See, vaccination, as I told you, is going to prevent you getting the infection. Number one. Number two, the severity of the illness will be less, duration will be less. And the recommendation is to, as per the CDC guidelines and other guidelines, the recommendation is to give everyone. But most important is the group of patients, those who have like pregnant ladies or females planning to get pregnant, elderly people, those who have chronic diseases like chronic liver disease, chronic kidney disease, obese people have lung conditions like bronchiectasis, bronchitis. These are the high-risk groups, though they must get vaccination. Other people, especially the normal people in this age group of middle age group and all those things, they may, if they want, they can take. If they don't want, still they can continue. It is not mandatory for them. But then once the infection comes in the community, everybody is prone to get it.
Touch wood, I haven't got it yet, but now I've said that live out on air, I'm going to get it.
Maybe you have some natural immunity for the...
Do you know what? I think I do, but I also think it's because I use all this that I grew up with, which prevents from... it keeps your body... You know, people go out there and buy turmeric. We've been eating it for 30, 40, hundreds of years. You know, these general things, healthy things that really do protect your body. Are flu vaccines safe? And what are some of the side effects?
Yeah. See, the flu vaccines are there for last 50 years and it is supposed to be very safe vaccine. Number one, it is because an inactive virus. So it is not you are not going to get the disease if you get the people have this misconcept that once we take the influenza vaccine, we may get the infection and we can have symptoms of...
Yes, that's what I always thought. I thought every vaccine you have, you'll get a similar symptom to it first.
No.
Ah.
So only few people can have some myalgia, some body ache, and which can just respond to some painkiller, and maximum some induration or redness or the site of injection. But otherwise, it is supposed to be very safe injection. It's even given in pregnancy. Anybody can take this.
Okay.
There is no this thing. Even there is one more thing I want to tell is that even along with the COVID vaccine, if it is due, you can take. Some people have some...
So you're saying you can take the COVID vaccine and the flu vaccine?
Yes.
So will the flu vaccine protect us against COVID-19?
No.
Ah, interesting.
It was there before when the COVID vaccine was not there, so people thought the influenza vaccine will protect, but it's not, because they are totally two different viruses.
These viruses, they're all over the place. What is the situation with COVID-19? Have you noticed generally, is it calming down with the patients that you're seeing, or?
It's very less nowadays, very less.
And the symptoms, are they
and
less?
Very few, very less symptoms. They're recovering well and all those things. We are not giving much of medications also.
And do you think this is because of the vaccine that's protected people?
It looks like it is obviously because of the vaccine that we could control the disease which was spreading like anything.
I know. It was crazy times. Fingers crossed everything will be fine. Dr. Pavan, thank you so much for coming in. I really appreciate it. And I hope you stay healthy throughout Christmas.
Yes.
Merry Christmas.
Yeah.
Merry Christmas
Merry
to you.
Christmas to you. And take vaccine and get
now you're telling me to take the vaccine. No, I'm going to have ginger first. And then if I have a flu, I'm coming back to you.
Okay. No problem.
There you go. He's pushing the vaccine on me.
This content is for informational purposes only. If you would like to seek medical treatment, please contact a certified healthcare provider for personalised advice and diagnosis.
Now, our next topic...